Okay, let's talk about something that so many of us deal with: hormonal acne. You know that feeling when you're doing everything right for your skin, but the breakouts just keep happening. It's incredibly frustrating. So in this explainer, we're going to get into the science of why this happens, and more importantly, we'll look at the treatments that are actually proven to work.
So, I have to ask, did you think acne was something you leave behind in high school, only to find it popping up again in your 20s, 30s, or even later? Yeah. If that's you, you are absolutely in the right place. It can feel so isolating, but I want you to know it is not just you.
And let's get one thing straight right away. Adult acne is a medical condition. It's a chronic inflammatory skin disorder. It has absolutely nothing to do with being unclean or something you're failing at. It's all about these really complex hormonal signals that are happening deep under your skin.
And get this, the clinical data shows that more than 80% of all adult acne cases are in women. Now that is not a coincidence. It points us directly to the huge role that our hormones play throughout our lives.
Okay, so let's get into the science of it all. Because if we really want to understand how to treat hormonal acne, we first have to understand what causes it. We're going to look at the specific hormones that are kind of flipping the on switch for breakouts.
So the main characters in this story are a group of hormones called androgens. You've probably heard of testosterone, that's one of them. And what we often think of them as male hormones, everybody has them. And in your skin, androgens have one major job. They send a signal to your oil glands telling them to start producing oil.
And this just lays it out perfectly. It's a chain reaction. First, you get that androgen signal, that on switch we talked about. That leads to step 2. Your skin starts making too much oil, or sebum. Then, that extra oil mixes with dead skin cells and creates a plug inside the hair follicle. And finally, that clogged, oily environment is the perfect place for bacteria to grow, which triggers the inflammation, redness, and swelling that we see and feel as a pimple.
But, while androgens are the main driver, they're not acting alone. Genetics play a massive role. So if your parents had adult acne, you're probably more likely to. And then things like stress, which can release more androgens, or even high-sugar foods and certain medications, they can all add fuel to the fire. All right, now let's zoom in on two of the biggest hormonal triggers for adult women: polycystic ovary syndrome, or PCOS, and the huge hormonal shifts that happen during perimenopause and menopause. Now, what's so interesting here is how different the why is. With PCOS, the body is actually producing higher than normal levels of androgens. But with menopause, it's a different story. Your estrogen levels drop way down, but your androgen levels only drop a little. This creates what we call a relative excess of androgens. So even though the levels aren't technically high, their effect on the skin is suddenly much, much stronger. And PCOS is really common. For a lot of women, that persistent, stubborn acne that just won't go away is actually one of the very first visible signs that there might be an underlying hormonal imbalance going on that needs to be looked at.
So here's the key thing to remember about menopausal acne. Your androgen levels could test completely normal. The problem isn't the androgens themselves, it's the loss of estrogen, which used to keep everything in balance. Without estrogen's protective effect, those normal androgens can suddenly go into overdrive, telling your oil glands to work way too hard.
Okay, so that's the why. Now for the most important part. What can we actually do about it? We're going to walk through the proven treatment plans that are recommended by clinical experts, focusing only on what the evidence shows really works.
First things first, the foundation for any acne treatment is just simple, consistent, gentle skincare. This isn't about harsh scrubs or stripping your skin. It's about using a gentle, pH-balanced cleanser and choosing skincare and makeup that won't clog your pores. Just look for the word non-comedogenic on the label. And of course, try your best not to pick. That just leads to more inflammation and potential scarring.
So for mild to moderate acne, the first thing a doctor will usually recommend is a combination of topical treatments, so creams or gels that you apply right onto your skin. It turns out that using a couple of different ingredients that work in different ways is way more effective than just using one. And these are the heavy hitters. Retinoids, which come from vitamin A, are amazing at helping to unclog pores. They're often paired with something like benzoyl peroxide, which kills bacteria, or maybe a topical antibiotic. Azelaic acid is another fantastic option because it kind of does it all. It tackles inflammation, bacteria, and that skin cell buildup.
Now, if the acne is more severe or really inflamed, your doctor might add an oral antibiotic into the mix.
But the key here is that it's for a limited time, usually about 3 to 6 months. The goal is just to get that inflammation under control while the topical treatments get to work for the long haul. But what if the topicals just aren't cutting it? Well, for true hormonal acne, especially the kind that clearly flares up around your period, we have to go to the source. And this is where treatments that directly target the hormones can be an absolute game changer.
And this quote really highlights a star player in this field, a medication called spironolactone. What it does is it actually blocks the androgen receptors right in the skin. So the hormonal message gets sent, but it never gets delivered to the oil gland. It's like putting a block on the mailbox. And the data shows just how well this can work. I mean, look at these results. When you add it up, a full 85% of women in these studies saw their acne either clear up completely or get significantly better. For a single treatment, that is an incredible success rate. So, we have all these great treatments, but there's one more really crucial piece of the puzzle we have to talk about, and that's managing our expectations. This is the reality of the journey to clear skin. Okay, let's be really honest here. There are no overnight cures for acne. It just doesn't work that way. Every single effective treatment takes time and, just as important, consistency. The goal is steady progress, not instant perfection. One of the biggest mistakes I see is people giving up on a treatment after just a few weeks, often right before it was about to start working. So this is a really helpful guide to keep in mind. For topical treatments, you need to give them at least 6 to 8 weeks to see a real difference. For oral antibiotics, think more like 3 months. And for those hormonal therapies like spironolactone, you've got to give them a solid 3 to 6 months to really see what they can do. Patience is truly everything here.
And once your skin is clear, the job isn't quite done. The last step is working with your doctor to figure out a long-term maintenance plan, which is often something simple like a topical retinoid. This is what's going to prevent new breakouts from forming and keep your skin clear and healthy. Look, just understanding the why behind your hormonal acne is a huge first step. The next and most important one is to talk to a healthcare professional who can look at your specific skin and history and guide you to the right treatment plan. Your journey to clear skin is so possible, and it really starts with taking that first informed and patient step.